All right, we'll go ahead and get started. Um, Today's presentation is on access to healthcare. That is my ethical topic for today. We'll go ahead and start off with the introduction. But first and foremost, I'm very, just want to say that I'm very thankful to be able to do this presentation, thankful for the information that I've learned and gathered, and I appreciate your time for listening. So going forward, let's get started with access to healthcare intro. So the access to healthcare intro, I'll be explaining here, giving the actual definitions of what access to healthcare actually means. I'll go ahead and read that off to you right now. Access to healthcare means having the timely use of personal health services to achieve the best health outcomes. Also have another definition here as well. Healthcare access is the ability to obtain healthcare services such as prevention, diagnosis, treatment, and management of diseases, illness, disorders, and other impacting conditions. So with those two definitions in layman's terms, access to healthcare kind of encompasses a variety of things, specifically being able to, I think when people think about access to healthcare, it's mainly thinking about actually getting to see a doctor or your doctor. Some of the big things that we may think of is, that may provide us access to healthcare is insurance, maybe actually paying for that access, your own money, being able to do that, maybe getting the actual facilities themselves, so a hospital, a doctor's office, gaining access that way. There are new elements now considering, we're post-pandemic, post-COVID-19, even through telehealth versions of gaining access to healthcare. So we do have that as well. So all of these elements kind of go into what access to healthcare really is. And then I'll go ahead and talk about why this may be an issue in today's healthcare or, health marketplace, why access is such an issue, what it encompasses, and what's actually going on here, why it's an ethical issue. So I'll go ahead and explain that now. So why is access to healthcare an issue? Why is it an ethical issue? What's the controversy? So as I was saying before, there are several things that kind of lead to access to healthcare. And then there are different barriers and issues that come up regarding access to healthcare, which is why it's can be such a controversial topic, or a topic in which you may have to consider your ethics or morals. So in this slide here, you'll see that there's a few things. So one of them that I like to mention is a high healthcare cost. I think that's the first thing that as I mentioned before, one of the first things you think about is how you're going to pay for healthcare that could be preventing you from gaining access. So many people may think that, especially in the American healthcare system, we pay for healthcare usually through insurances. A lot of those insurances are private. We do have a government type of insurance known as Medicare or Medicaid. And a lot of people are enrolled in that particular healthcare. So that's a big chunk of our healthcare expense as well. But another chunk of it is the private sector. And so those private sectors get to, ultimately choose and bid and pick different rates for different services that a healthcare provider may offer. And so with that might bump up the cost. Now, I haven't even included if you don't have insurance at all, if you have to pay out of pocket, because a lot of those private sectors, they're bidding, that drives the healthcare cost up. And so that begins to be an issue for those people who cannot gain access through their insurance. Next, you have racial disparities, racial biases. Talk about those for a quick second. So, racial disparities, there's a lot of factors that can play into that. Maybe there's a big history about how certain groups of people may not have, or even now have, the same access that other groups of people may have. That could be due to, their poverty level, income, class, status, a lot of different things regarding that, just based off of race. Racial biases, that can be a factor as well. Also want to mention another bullet point here is transportation barriers. I don't think a lot of people may think about how difficult it could be trying to actually get to a medical facility, especially if you live in a rural area. That can be really difficult to do. A lot of elderly have issues or trouble getting transportation to medical facilities. They often are not able to drive themselves. They may not have the funds to even have a vehicle in the first place. They may not have family that can take them to their appointments, to keep up with their appointments. So that may be one of the issues as well. So transportation barriers is definitely a factor. Then you also have work-related barriers. Now, a work-related barrier would be maybe your job doesn't offer adequate health insurance. Maybe it's too expensive. Maybe it's not just expensive for you, but what if you have a family? Then that insurance becomes more expensive. So then that becomes an issue. And then sometimes not only just what they may offer as far as health benefits, but also the job itself. Some people find it really difficult to take the time off of work to actually go to their appointments. So that becomes stressful and difficult within itself. They then lose out on a lot of access to healthcare that way as well. And then another way, language barrier is another issue. So if you're seeing a provider that doesn't speak maybe your first language and their first language is different from the patient's, then there's a disconnect. It makes it very difficult for that particular provider to connect with that patient. And if you can't connect with the patient, or that patient doesn't feel like they're connecting with their provider, then that becomes an issue. Then they're less likely to want to go see that provider. If there aren't many options as to maybe within that patient's health care insurance to see these different providers, then they're kind of stuck with providers that may not speak their language, foregoing and ultimately foregoing their want to even be seen by a provider, or to even be seen at that point, because they can't connect to the provider. So that becomes a barrier for them. Lastly, I wanted to talk about the lack of providers within healthcare in general. So that reduces the access to healthcare as well. There's definitely, we heard about this during COVID. It was really difficult, and still is. I know there are many things trying to be done in the healthcare industry, but to be honest, there's just not enough, manpower to go around for everyone to be seen. It's a lot more sick people than there are providers, and it just makes it really tough. And so that increases the loss in access as well. So many of these can just be factors in the sense, in the big picture of access of healthcare. But some of them are ethical issues: the racial disparities, the racial biases, the high healthcare costs is probably the biggest one as far as being an ethical issue, because a lot of Americans and people in general feel as though we pay too much for healthcare. That's our biggest issue, is the cost of healthcare, which discourages and essentially eliminates people from being able to be seen by a provider. So that is a lot, many of these subjects are really the controversy and the issue of why this is access to healthcare is a really big deal. I'll go on to the next slide. All right, next up we have ethical theories related to access in healthcare. Beneficence, which is a word that I was having quite the trouble saying from time to time, so forgive me if I may mess up on here as well, but hopefully I said it correctly now. That definition for that one is: regardless of specialty, healthcare practitioners perform acts to help people stay healthy or recover from an illness. In fact, their first duty is to promote health for the patient above all other considerations. Next, one of the ethical theories is justice. So justice is what is due to any one particular individual. Now, when talking about these two subjects, beneficence, again, I knew I would probably say that incorrectly, but when we're discussing that particular one, it says, regardless of specialty, healthcare practitioners perform acts to help people stay healthy or recover from an illness. If these two theories are within healthcare, it's kind of hard to have providers cut off some of the access due to the barriers of insurance or due to the barriers of, what they may think about race or class. And I know those things aren't done in the open. But if we're just talking about these two theories alone, they relate to the access to healthcare very much, because if we're talking about these two theories, it's stating that they have a duty. Their first duty is to promote health for the patient above all other considerations. Above all other considerations would be means of money, insurance, what you look like, what your class is, etc. As far as justice, what is due to any one particular individual? This theory is related to healthcare because it's how can we determine in healthcare what is due to someone else? I would like to read a passage from the book, actually, to kind of further this point, or at least let us think about it some more. So from our book that we've been reading in class, says here, justice, defined as what is due an individual, seems simple when applied to the U.S. healthcare system, but it is often complicated. Many would argue, for example, that everyone is entitled to health care, regardless of the ability to pay for the care. Others argue that the distribution of scarce resources and the expense of providing them do not allow us to provide all care for all patients. Still, others argue that people must take responsibility for their actions before assuming they can have justice. Here's an example here. Should a lifelong smoker who refuses to quit and develops emphysema and continues to smoke be entitled to all available health care, regardless of cost? Should a motorcycle owner who refuses to wear a helmet while riding his or her motorcycle, or an automobile driver who refuses to wear a seatbelt, be entitled to all available health care in the event of an accident, regardless of cost? Now, those are things to really think about. Now, they are very specific examples, but that is something to think about, and that may be furthering the opposite point, right? But that's a kind of case-by-case basis. But if we're looking at the whole, when we're speaking about justice, I would like to argue that the population at large are not doing things to impede upon their own health that in that specific way. In fact, if they had better healthcare access, they would have better education as a way of how to live and better their health. So I get what they're saying in this passage here in the book, and regarding those specific points, but I would like to offer the flip side of that too, and take a look, maybe suggest that we take a look at it as a whole. I'll move on to the next slide. All right, one of the next topics we want to look at is standard of care and negligence. So these are two things in law, in healthcare law and standard, that healthcare providers have to go by. I picked these two because I feel as though they help with the argument of the ethical issue of access to healthcare, and some of the issues within related to access to healthcare, as we discussed earlier. So standard of care. The standard of care is used as a benchmark against other healthcare providers. That just means, in layman's terms, that what other providers do, if something, that particular care, if multiple providers do that one thing or do specific things to provide this particular kind of care to a variety of patients, then that is the standard that they will go by. Provider doesn't have to do any more than that. As long as they do up to that point, then that is the standard of care. If they go above that, great, but that is not expected. So they use what the majority do as a benchmark. Next, we have negligence, an unintentional tort alleged when one may have performed or failed to perform an act that a reasonable person would or would not have done in similar circumstances. With particular to access to healthcare, standard of care, and negligence, a provider must be aware of these things, because if you do have any of those, biases, or I think it would help with, certain issues as far as how the provider may see who to care for and how to care for that particular person. Sometimes I think maybe, there may be certain biases depending on insurance-based biases. So maybe if someone has Medi-Cal versus somebody that might have a PPO, that provider may treat that patient different. But that is not to the standard of care that they should be treating that patient. Or, if we're talking about negligence, then this could be an example that could be a provider needs to be aware of that in regards to maybe, if there's racial biases. I'm not going to test if I'm the provider. I'm not going to test for, any further because this particular group of people or this person doesn't need it because of the color of their skin or where they came from or how they're different. So those laws and this protocol is important for a provider to understand and know, because it contributes to the lack of access. It contributes to those biases. It contributes to the insurance issues and biases that we have within that as well. So it's good for a provider to understand and know and have a standard, for lack of a better term, to be able to uphold healthcare to the utmost. So just wanted to kind of touch on these laws and ethics a little bit, to help further the point or also add to the ethical issues of access to healthcare. All right, next up we have laws related to access to healthcare. So these are specific laws that either basically help with the access to healthcare that exactly pertain to it. So this is pretty important here. So we have timely access to care. Timely access to care is basically making sure that a patient within their insurance, whatever insurance they have, see a particular provider within a certain time frame. So that has been made into law. I believe the different regulations based on the healthcare, based on the insurance, but there are regulations there to make sure that that patient sees their provider within a certain time frame. So that is one of the laws to help with access. There's also the EMTALA, that's the Emergency Medical Treatment and Labor Act. So this one might have been, this is a pretty popular one, or one that we always hear about normally, or I've heard about before doing this. And that is, say for instance, a patient walks in, or a person walks in the emergency room, bleeding, something's wrong, not breathing. This is the act that states, regardless of who they are, insurance, no insurance, they have to have them bring them back to stability. I would like to read off from the website nhtsa.gov. Hospitals have 3 basic obligations under EMTLA. First, they must provide all patients with a medical screening and examination to determine whether an emergency medical condition exists without regard for ability to pay for services. Mentioned that just now. And then second, where an emergency medical condition exists, they must either provide treatment until the patient is stabilized, or if they do not have the capability, transfer the patient to another hospital. And then third, hospitals with specialized capabilities are obligated to accept transfers if they have the capabilities to treat them. Medical care cannot be delayed by questions about methods of payment or insurance coverage. So this is a great law. This is one that adds to more positive outcomes for access to healthcare. So that this one was enacted and put in place. Then we have recently, this is specific to California. This is regarding mental health care. I know we always think of, clinical as, when we're thinking of access to healthcare, but now mental health is a part of this as well. And so we have the SB 221. So this law that has just been passed states that people that need mental health care, they'll get that care through their insurance. At first, they were just obligated to get that first appointment, but now they're going to be obligated to also have follow-up care. So not only do they get that first appointment, but they'll have follow-up care after that. As before, there was nothing in place to determine that. So this is something that is beneficial. One of the arguments for this, it being taken as long as it has regarding that, is also lack in providers. A lot of mental health practitioners, are lacking, not enough people just to do the job in general. So that's where we run into some issues there. But with this, hopefully more money will be poured into that system, and then they'll be able to follow up and have those appointments as needed. Very beneficial. All right, so I put here, let's argue. So this is basically my ethical arguments for why this is an issue, why access to healthcare is an issue, the different topics that we discussed, kind of adding to what I already stated before, but just looking at different viewpoints from my perspective, and hopefully can articulate this well enough to make it make sense without just having a bias of my own. But just wanted to bring up some different topics to have a different perspective. So the first one is the different parts that make up the issues for access to healthcare are deeply rooted in systems of injustice based on race and class. So I think if we could, I think a lot of this is bigger than just the access to healthcare. There's so many moving parts. Many people may think that it has something to do with capitalism. When we're talking about the racial and racial biases and the disparities, racial disparities, that goes deeper than just at the forefront of healthcare. Much of the country has experienced, whether it's in healthcare, the education system, all these different systems, we've seen this type of enforcement, right, regarding race and class. And so it's really a deep rooted issue, which I think we need to think about ethically as well. So not only will we be stopping the access to healthcare, but I think we would be answering so many other questions as well if we could get deep down into what the real issues are regarding this. So I think if we could tackle that, we could tackle some other things as well that are related to all these, to the money issue, to the classism, to race, etc. Next, what if it was you or a loved one? If you're a provider, or if you're not for certain aspects that help with access to healthcare, maybe one person may argue universal healthcare, and someone may be against it because, they are wondering how we're going to pay for the expenses of healthcare. Well, what if it was you or your loved one, and they needed health care treatment, or you needed health care treatment? So I think a lot more different viewpoint. A lot of things and answers would change if we put ourselves in those shoes, or put a loved one in those shoes. What would we do then? Would it be so much about what insurance we have, what we look like, where we're from, how much money we have? Would that be the case then? I really don't think so. So I think if we could look in that sense and apply it to the population and figure something out that helps us all, then that would be the best answer. Another point is, what is our motive? It may be time to look at our system as a whole. I say that kind of piggybacking off of what I've just mentioned earlier regarding a loved one. What as far as the healthcare system, is it too? I think a lot of, with the private payers and us bidding for these different medical procedures and surgeries, why is it so money based? Why is that the motive, or why does it seem like that's the motive? It's weird because it's, at one sense of healthcare, it's about the patient and care and making sure people are safe and procedures are done correctly and looking out for the well-being of others. But on the other hand, it's this dark side of this, capitalistic endeavor that seems to be never ending. And so I know that if we were to do like a universal health care or something regarded to cheaper medical care for everybody, that many professionals would have to take a pay cut. And I don't know how well that sits with everybody. And I get it. I understand many people go into the healthcare industry for stability and knowing that they'll be able to be sustain their families for a long time. The healthcare industry is a huge staple in the country. So I know if we touch that and change the ways of that, it would be a big deal. It would be a big domino effect. But we have to think about the result of what we're doing now, and how that's affecting the people in general, the bigger population. What can we do to split the difference? What can we do to make a difference? So maybe we need to think about the system as a whole. And then lastly, health is our best asset. At the end of the day, that's really all we have as people. If you or anybody else who has declined in health, or anything of that sort, it is such a big deal. You can't do anything in life without your health. Now, don't get me wrong, there are still things that you can't, but it makes life really difficult. And so having your health and being in the best of health is, one of the best things that we can do for ourselves, and being able to be of use and help to other people. And so I think as a healthcare system, we need to really think about that, and how we can continue to promote that, and what can be done so that everybody is their best selves. I think no matter how much money you have, anything, if your health goes, you're gonna want to be healthy. There's no price tag on that. And so I don't understand why we sometimes have to put a price tag on the different services and things that we do when we're discussing, when we're thinking about people and the population. So I think, those points is just something that I wanted to bring up as far as my ethical issue or ethical standpoint. So wanted to discuss that a bit, and we'll move on to the last slide regarding a Christian perspective. So lastly here, just wanted to discuss a Christian perspective when thinking about access to healthcare, our healthcare system in general, different providers and their decisions. So I have 3 scriptures here, Romans 12:10, that states, "Be kindly affectioned one to another with brotherly love and honor, preferring one another." I have 1 Peter 4:9, "Use hospitality one to another without grudging." And I have Matthew 6:21, "For where your treasure is, there will your heart be also." So the first one, and basically what I wanted to do with these scriptures, I really just looked up what service was in the Bible. What does to service others mean? And that's when I had the first 2. Be kindly affection one to another with brotherly love and honor, preferring one another. So I think the healthcare industry, it's a service. We're trying to serve our fellow man, and we have to remember to do that with brotherly love. And I don't think that's always at the forefront. So I think, if we did look at things with a little bit more Christian perspective, we can solve a lot of these issues. Next, I have 1 Peter 4:9, use hospitality use hospitality one to another without grudging. Use hospitality. I mean, just be there for your fellow man without grudging, without making a fuss, that I can't pay for this, we can't pay for that, this doesn't work, this is taking money out of our pockets here. If we could just serve one another wholeheartedly, without grudging, with brotherly love, I think we can go a long way. And then lastly, we have Matthew 6:21. For where your treasure is, there will your heart be also. That scripture kind of made me think about just what is the motive. If money is the motive and that's the main objective, then that's where your heart will be, and your decisions will show. And I really hope that that's not the case with all providers. I'm not saying providers and doctors are bad and this or that, but regarding a lot of this access to healthcare, we want to think in the direction of the hearts of the people, the heart of why providers do what they do. Why did they become doctors? What's at the root of this? That is where your heart will be. That's where the treasure will be. So just a few things to think about there as far as a Christian perspective. I pray that this will all get worked out at some point, or at least we'll continue to make strides towards having a better access to healthcare. I know there's a lot of touchy subjects regarding that and ethical issues and things to think about, but I am happy that I was able to do some research, learn a few things, and think about a few things, as well as definitely being in the industry myself. It's definitely great to think about, and definitely something that I want to work towards and hopefully contribute to, giving more access to other people. And so I'm just thankful for this opportunity, and that is my presentation for today. Just wanted to let you know, thank you for listening and appreciate it. Thank you.